Hello and welcome to Moneylife News and Views. I'm Debashis Basu. All the smart people from the investing world with years of experience were waiting for the government to deliver a financial package which would support businesses and ease the pain, the economic pain of the lockdown. But their hopes were belied, and once again. And yet, the next time there is a similarly gloomy scenario about something or the other, you can be sure that the same people will have very similar expectations from the government. I can't understand why. The Indian state has been weak and remains weak, but our expectations from what it can deliver remains very strong. At least the state's capacity in economic and financial matters is easy to know, and because we can use both the current data and historical data. We can draw upon well-documented history of what happened in the past. We can use well-applied economic concepts, and yet we keep expecting the government to do a lot. Now, what happens when we are in an area which is uncharted, like a pandemic? When the lockdown grounded 1 billion people, nothing had been planned well. Testing, masks, face shields, protective gear, medical equipment, contact tracing, nothing. Doctors, nurses, health workers, and other municipal workers were thrown into handling COVID without much protection at all. Soon, the country discovered there is a huge segment called migrant labor. Millions of people who had been living on daily wages away from their home in urban slums. Overnight, they were out of jobs and they wanted to go home. The state had no plans for them. Even political parties that can summon hundreds of buses to ferry people to their own rallies before elections, they were just standing there and watching. Had it not been for the NGOs and benevolent individuals, there would have been large-scale starvation due to hunger. The state's poor capability and intent was obvious. To divert us from all of this, the PM encouraged us to bang thalis, clap hands, and light torches. If all this offers any indication about the capacity of the state, what should we expect when we exit the lockdown? I'm afraid we'll get hit hard in 3 ways. Number 1, the main idea of imposing the world's severest lockdown was to break the chain of transmission of the disease and flatten the curve of rising cases, thereby avoiding tens of thousands of deaths in a country where healthcare, both private and public, is very poor. Have we achieved this? The government claims we have. Dr. V.K. Paul of Niti Aayog has claimed that the lockdown has averted 14 to 29 lakh infections, 37,000 to 71,000 deaths. By the way, the same Dr. Paul's presentation on April 24th had projected COVID cases to come down to 0 by May 16th. The facts on the ground are grim. Different states count differently. Many deaths are not reported as COVID deaths, and politicians in every state have a vested interest in undercounting. Despite all this, India is reporting highest single-day surge every other day. Now just add these two factors together. We are opening up and the curve is rising. What could be the outcome? The issue number 2 we're going to face is in dealing with rising cases of COVID, the local administration in each state have requisitioned even private hospitals. Now, these hospitals are already bursting at the seams. There are helplines to inform where empty beds are available and too few beds are free. Or there is a poor coordination between the hospitals and the helplines, and when the patient is taken to the hospital, they're told that no bed is free. A family of a doctor in Mumbai, a COVID patient, could not find a bed even after 5 hours of trying, and later the doctor eventually passed away. The bigger problem is healthcare for non-COVID patients. In hospital after hospital, patients and doctors are testing positive. When this happens, either the hospital shuts down or patients avoid it. Patients who need regular hospital visits like chemotherapy or dialysis are left high and dry. Those that are open are being accused of hugely overcharging the patients. In response, the Maharashtra government has requisitioned 80% beds in private hospitals in Mumbai and capped their charges till August 31st. As COVID cases rise, the situation is likely to get grimmer. Point number 3. License Raj. Businessmen are warning that in trying to manage COVID, we are sliding back into License Raj that will stifle the economy even more. Between them, the center and the states have issued almost 4,800 advisories so far. A businessman told me that these COVID advisories and restrictions are a great opportunity for petty officials to extort money and at the very least unleash a wave of arbitrary behavior by those officials. This is especially true outside the cities where district officials and police officials operate their own fiefs, interpreting government notifications as they please. Before COVID, many didn't know that the state has no money, no intent, and no capacity to govern wisely and humanely. Well, if you didn't know, you were just simply blind. But after COVID, if we continue to look up to the state, look forward to sort of financial package for our benefit or to help the economy, or ask, at least, which we keep asking all the time, what is the government doing? Well, the government can't do anything. It doesn't have the capacity. But if we keep expecting, as I said, if we have strong expectations from a weak state, the joke is really on us. Thanks for watching.